So thank you, Jess, for giving us an opportunity to serve your patient. Would you like to tell us something about your patient? What was her condition? About your mother when she came to the hospital? What happened?
Yeah, so my mom is like about 20, 85, 84 years old, a lady, and she was having a really hard time. Problem with her breath, and it had been going on for a few days, and that day she was really gasping for her breath, and we could see her going drowsy, and it was really an emergency situation. So we called you guys, and then the ambulance was sent over, and she was brought to the hospital, and she was taken into the emergency and then shifted to the ICU right away, and she was put on the ventilator, which at that point had to be, was the only resource we could think of, even though we were reluctant, and we were not sure if we should put her on that. But just to have that, we didn't have much of a choice at that time. So she was put on the ventilator, and which really helped her, and she came out of it like within 48 hours or so. And then even at that point, she was not really breathing on her own, but then her condition had improved a lot. So in order to help her in bringing up that breathing pattern, she was put on BiPAP on and off.
Right.
Yeah. And then initially when we brought her here, she wasn't responding to us at all. She wasn't, she was like completely, you can say, dazed out or something like that. And then once she was coming back or regaining her consciousness, I would say, she was listening to us, and she would respond to us when we called her. And she started recognizing her, which was like totally out when she was brought here. So yeah, she now is in a very, I would say, not a very good shape, but she is in a good, we feel is in a good health, and we are looking forward to taking her home.
Right, that's very nice.
Yeah.
So for an 85 years old lady with breathing problem, everything, were you really apprehensive when the doctors told you that she might require ventilatory support, or what were the thoughts running in your mind?
We discussed that with the doctors before we made this decision, and even though the chances were, with her age, it wasn't much, but we didn't want to miss even a 1% chance to revive her back.
And it has turned out to be a good decision.
Yeah, we're glad that we made that decision.
And were the doctors talking to you, or the staff, or somebody from the hospital talking to you throughout? Were you counseled daily or on a regular basis?
Yes, they were. They have been really cooperative that way, and sometimes I feel like even in ICU unit we would like go and see her, but the doctor wanted us to be meet him every day and give us an update on what was going on with her.
That's very nice. That's very
Yeah.
nice. And how did you find the overall experience? I mean, I know nobody would like this kind of an experience, but staying in the hospital, the facilities of the hospital. So, what are your comments on that?
I would say it's for us with our mother and with her age and everything, we are really blessed to have her brought her here, and to have her back going home with us now.
That's good. And one last question. So, if we can discuss about the cost of the treatment that you had to bear for this particular treatment for this length of stay. So, what are your comments on that? I really don't want the exact numbers, but then overall perspective.
I think it's pretty feasible for us. Like it's not, if something was like, it's not something that we can do or we can afford for our mom. It was pretty flexible and was pretty feasible for us to pay for that. Yeah, it was not something that we can do, or it was out of the blue, or out of
nothing surprised
you. As a that's it.
Thank you, Jess. Thank you.
Yeah, thank you.
And hope your mother recovers soon.
Yeah.
And you guys go back home.
Yeah, that's what we are hoping for. We're really
you.
excited that she's going back tomorrow.